Hello, Enid. I am Diana Hernandez, Public Information Officer at Garfield County Health Department, and with me today is John. You want to introduce yourself?
Hello, folks. My name is John Gray, and I am with the state. I am the Community Drug Overdose Prevention Coordinator for Garfield and Blaine counties.
Awesome. Thank you, John. And in a little bit, we'll touch more about what John does, but we're going to jump right into it. Now, from the Oklahoma State Department of Health, what you need to know, and we're going to jump into what they launched last month, and they sent it out in a press release, a Work at Health initiative. And a little bit behind that is the productivity losses related to personal and family health problems costs in the U.S. Employers more than $225 billion every year. In an effort to minimize these health-related costs, the Oklahoma State Department of Health is seeking public and private businesses and organizations to participate in a no-cost employer training program to help build and maintain effective workplace wellness programs. Work at Health is a free training program for employers to improve worksite wellness and strategies to reduce chronic disease injury risk to employees. Workplace health programs can help employees adopt healthier lifestyles and lower their risk of developing costly chronic diseases. Work at Health trainer Karen Lineback said research shows that employees who have healthy diets and active lifestyles are less likely to suffer from chronic illnesses or disabilities that might hinder their job performance. By implementing comprehensive and evidence-based programs, employers can improve worker productivity and build a culture of wellness that improves the bottom line. More than 300 employers in the U.S. have been selected to participate in the program, with 45 in Oklahoma, including Imperial, Oklahoma State University, United Way, LifeShare. To be eligible, employers must be headquartered in the U.S., provide health insurance, and employ at least 20. A maximum of 2 participants per employer may attend the training. Employers interested in the Work at Health program can contact Karen Lineback at karenl@health.ok.gov or call 405-426-8294. And for more information, you can visit cdc.gov/workathealth. And this weekly Oklahoma COVID-19 epidemiology and surveillance report for August 14th through 20th is now available. You can search it at oklahoma.gov/COVID-19. Currently, new cases 7-day average for the state of Oklahoma is 1,140. New cases week of August 14th to August 20th, 7,981. Active cases, 16,238. And for Garfield County, cases previous 4 weeks in Garfield County, 619. And for monkeypox for the state of Oklahoma, we do have 22 cases now for the state. Now, for more information, you can visit oklahoma.gov/health, select monkeypox. CDC has also released information at www.cdc.gov, searching monkeypox. You can also find related up-to-date information about monkeypox vaccination criteria at Garfield County Health Department Facebook page. Now, if you want to call, you can always reach us at Garfield County Health Department, 580-233-0650, but also a call line at 211 to find vaccination near you, or if you need more information or if you have questions of criteria for the vaccination. Now, August 31st is soon approaching. It's around the corner. It is National Drug Overdose Awareness Day. And for September, these are some awarenesses coming up. Labor Day, of course, National Disease Literacy Month, National Childhood Obesity Awareness Month, National Sickle Cell Awareness Month, Pulmonary Fibrosis Awareness Month, Polycystic Ovarian Syndrome Awareness Month, Prostate Health Month, and National Suicide Awareness Month. And for the National Suicide Awareness Month, I wanted to go ahead and point this out. 988, it is the mental health crisis line. It is the new hotline launched in July 16th of this year. It is reachable from anywhere in the United States just by dialing 988. You can also text your message to 988 number, and that will connect you with a trained crisis counselor. And back to August 31st, the National Drug Overdose Awareness Month. And this is why John is here, and he is our drug overdose prevention coordinator. Now, we're really excited. Now, public health, what it does, it pivots to the needs of public in health perspective. Now, what does a drug overdose prevention coordinator do?
Well, in short, this person helps to orchestrate all nonprofits or businesses that have a leaning toward wanting to help with the prevention of ODing on drugs. So that could look like partnering with hospitals. It could look like partnering with the nonprofits in the area in which I serve to help spear point efforts to stopping or at least curtailing overdosing.
Now, is there a drug overdose concern in Garfield County?
There's a national as well as international concern. What concerns me most is the street drugs are not, they don't go through the FDAC guidelines. And so you can have drugs that are put together that would have opioids in them, fentanyl in them, heroin in them, and any other drugs that could be used with which to get high, to use layman terms. The problem with that is there might be drugs introduced that are more robust, and when that happens, that leads towards not only overdosing, but it also could lead toward death.
And what partnerships are you looking toward making and building in the near future?
Well, as the program that I'm overseeing runs the gamut between childhood through adults, one of the advisory boards that I like to put together would be comprised of children between the ages of say 13 and 18. They have their boots on the ground. They know what things look like from their perspective. And so I think it's important that we have an understanding from that age group perspective how prevention could look like, as well as having that same picture shined on people who have gotten over their dependency on drugs and or in the process of either recently being in an overdose situation, so we can get a better understanding of what works in a boots on the ground kind of situation.
Awesome. Well, thank you, John. Is there anything that is insightful for Garfield County and the communities and those watching?
Well, what's insightful is our community really is a village. Mm-hmm. So we have to come together as a community to fight this. It's not going to just be me. It's not going to just be the decision makers. What we need to have is a total understanding, because when we're talking about drugs in this matter, we're looking at mental health. We're looking at self-care. We're looking at every myriad difference in the health community with which to combine efforts and move all initiatives with overdose forward.
Awesome, thank you. And if you are an individual or a group and you would like to partner with the Garfield County Health Department and specifically with the Drug Overdose Prevention Coordinator, reach out to us at 580-233-0650 and ask for John Gray. He is our overdose drug overdose prevention coordinator, and he would be happy to coordinate, collaborate, and steer public health in this new robust way. So thank you, John. So we're going to go ahead and jump into the mobile wellness unit. This is public health on the go. Sometimes we get busy and we go, and sometimes we want to replicate ourselves into another person so that we can cover more ground. But this is, in a sense, what public health has done. So this is Garfield County Health Department Public Health on the go, and you will see us in the community. We love partnering with events, individuals, groups, and bringing services to communities who otherwise wouldn't have access to services that we provide at Garfield County Health Department. And if you would like to partner with us, if you have something coming up, if there's going to be a group, if you're a school or organization, we would love to partner with you. So reach out to us at Garfield County Health Department, or there's also a line available on your screen. And some exciting news, our mobile wellness unit got a new look. So if you see these guys driving around, give them a honk and give them a thumbs up, and let them know that they're doing a great job and they're looking good while they're doing a great job and providing these services. So way to go, Public Health on the Go team. We appreciate you guys for all that you do. I know you guys work crazy hours, and thank you very much for all that you do. And we have many services and programs, to family planning, to WIG, to testing, COVID testing, of course. If you need a COVID test, osdh.amitech.com is a way to schedule your COVID test. We do immunizations for children. We got many sports physical done for bus drivers and students, and so we enjoy what we do very much at the health department. And we will not be open for Labor Day, so forecasting this, we will be closed in observance for Labor Day, September 5th. But feel free to contact us via Facebook if you need to reach out to us that day. I was like, but we will be open the next business day. And that is it. Thank you, John, for joining me. And that is all we have for this community health update. Until next time, we'll see you guys, and stay healthy, stay safe, and stay cool. Bye.